written a lot of papers and we need to learn a lot from them.
Bismillahirrahmanirrahim. I'll be just presenting a few of the papers which we have written. I declare no conflict of interest. Next. We should be aware of this black market. And IHRS is probably the first society to announce black market. As we know, our field of hair transplantation is basically passing through an evolutionary phase. So this is the punch which was used by Okura in 1939. It's about 4 millimeter punch. So these were the scars of the past. Next. And this is what we get today. So we have to see after a few years that what we are going, in which direction we are going. Next. So there are basically two schools of thoughts in training in hair restoration. First is proper training, the other is hidden trial method. Next. So we have written about 120 research papers, with about 50 of them are related with hair transplant, 3 books, 2 chapters. Next. These are the 3 books. Next. Chapter. Next. Next. So there are the basic innovations are related to the basic knowledge, the regenerative medicines, the strip surgery and FUE. Next. So this is a new classification system which has been published. Next. It is published in all major 3 peer-reviewed journals. Next. Just a brief description of the system. The N stands for Norwood, the P stands for temporal peaks, R for reverse thinning, and T for overall thinning are basically the density of the hair. Next. So this is a sub-classification of temporal points. We divide it into 0, 1, 2, and 3. Next. This is a classification for reverse thinning. Reverse thinning means the hair loss in the mastoid and occipital area. It also has 4 grades, 0, 1, 2, 3. Next. The overall thinning, basically the density, that is T0, no thinning, mild thinning, moderate thinning, and severe thinning. Next. How to document it? Just write the Norwood scale and the grades of the temporal peaks, the reverse thinning, and also of the total density. Next. This is another example. Next. Another classification, as in Cole's lecture he was describing, we are stuck with the classification of the follicular units. So this is basically a new classification for follicular units arrangement. It's the distribution of those hair within those follicular units. Next, and there are 4 classes in that. This is linear. Next. Example, this is linear. If you have 4 or 5 hair in linear arrangements, this is called L5. Next. Next. So this was about the safe donor area. Next. In regenerative medicine, we use platelet-rich plasma and we use the adipose stem cells. Next. So this was a study in which we used the PRP in the donor strip surgery scar, and definitely it reduces the width of the scar and the quality and improves the quality of the scar as well. Next. Next. And this was the effect of PRP on hair loss. So the result of PRP is the reversal of the exclamation sign, that you start to see the growth of the hair at the bulge. Next. Then various innovations in local anesthesia techniques. We used anterior and superior approach, different vibration anesthesia and topical anesthesia. Next. These are different studies which document the different protocols of these nerve blocks. Next. This is a way to use a vibrator and use the use of the vibrator while administrating the local anesthesia. Next. And this is the supraorbital, supratrochlear nerve blocks approach, it's the anterior approach and it is the superior approach. And we found that the superior approach is more comfortable to the patients as compared to the anterior approach. Next. And these were the two clinical studies published. Next. Effect of syringe on the size of pain. Definitely the smaller needle with the smaller syringe results in a lesser pain while administering the local anesthesia. Next. The effect of tumescence on hair angles. Next. This paper is also published. If you can alter the hair shaft angle by injecting different amount of local anesthesia, tumescent anesthesia in the donor area. Next. A few techniques about strip surgery. Next. Next. So this was a new cosmetic surgery scar assessment scale, and we documented the scars of 50 patients undergoing hair restoration. Next. This is a very unique idea, and it is also published. Occipital hairline. We all emphasize on the anterior hairline, but very few of the people, they will emphasize on the occipital hairline. We do have an occipital hairline on the posterior part. Next. And this is the use of mirror to correct the hairline. It's a technique. Next. Rule of thumb. You can use your thumb as a guide to draw your hairlines. Next. This is a very simple technique to strip harvest. Next. And it was published in HRSP forum, and then we have compared the three techniques: the Haber technique, the Patham's technique, and this scissors technique. Next. If you can play the video as well. No. Okay. Next. So this is a very simple technique. You just give a score. Back. It's a very simple technique. You just give a scoring in C and then put the scissors inside and dilate it. It will reduce your transaction rate in strip harvesting. Next. We all take photographs, but we are afraid of using the camera flash. Just these photographers use the reflector, just use the reflector, use the flash. Next. A new classification we basically presented for the temporal area restoration. In area 1, use only single hair grafts, thin single hair grafts. In 2, use two single hair grafts, but you can use a thicker one. And in this zone 3, you can use 2 or 3 hair grafts as well. Next. So this was a new technique which we presented and got the first prize in 2017 as well for temporal peak restoration. Next. This is the measurement of tension on both the flaps while we are doing the strip surgery. Next. This is the comparison of single layer and double layer closure in the strip surgery. Next. People are calling it hybrid. We call it extended hair transplant because you can get maximum number of the grafts, so it is basically an extended type of hair restoration. Next. So this was a closure technique. Next. Irregular. So this was a new sort of blade which I have tried in a few studies. It's a curved blade, it's not a straight blade. The patent is pending and it will be available shortly. Next. FUE. Next. This is a technique which I use. If you can change the hair angle, you can change the direction of your punch, then this will result in the decrease in the scarring in the donor area. So what I do, I inject the normal saline at 3 different levels, and then with the help of the thumb, I can change the angle of the hair shaft exit, and that decreases the transaction rate. Next. Unfortunately, we cannot play the video. Next. Next. So basically, it was a tech to show that we can change the direction. So this is a new kind of FUE punch, which is not available in the market. The study is published and it will be basically presented in the Manchester in June, hopefully. Next. Lastly, we all emphasize on the surgical point of view, but we do not have a hair transplant assessment scale. So we have devised this scale in which we basically count the hair, anterior hairline, the mid zone, the frontotemporal angles, occipital area, and the donor area.